New Mexico Cancer Center and Health Specialists of New Mexico are the proud sponsor of Health and Wellness on New Mexico Living.
I am Catherine Sanchez. I'm a medical oncologist and I specialize in breast cancer. I have been back in New Mexico since 2022, and we are continuing to grow our breast cancer research program. We are expanding and going to have more surgery and also do radiation oncology. So really building a breast program so that people have better access. So breast cancer is the most funded research in all of cancer research. So when you look at research dollars in terms of all cancer types, breast cancer is 50%. Breast cancer affects 1 in 8 women. It's a very common cancer. Some of the major changes in cancer treatments have come from breast cancer research. There are many different types of research. There's research in a lab, there's research that happens before medications are given to humans, and then there's medications which are later phase clinical trials when medicines are introduced into people who have cancer. And that's changing because the more we know in the lab, we're actually able to introduce medications sooner and faster. So we have access right now to a huge number of clinical trials. And I think that in breast cancer, having access to clinical trials is no longer really a part of something special, but is a part of equitable care, because it really means early access for a lot of people who are on the trials to treatments before they're available. So when I came back home, it was one of my goals to really try to expand access to clinical trials here in New Mexico, mostly because women can't travel. Most women who are on treatment are still working, are taking care of their children, taking care of their parents. And when you have somebody on clinical trial in another state, you have to stop your life. And so we really have spent a lot of time building up our research program and opening clinical trials that are meaningful for women in New Mexico, that allow them to have early access, give them additional options that they didn't have otherwise. It's one of my true passion projects. I want people and women in New Mexico to have equitable care in cancer. As we expand research here, I think it opens a door for us to have clinical trials in other cancer types, but also some of the main breast cancer research that we do has actually led to approvals in other cancer types. I think people think historically about clinical trials as being kind of the last resort, meaning that, we ran out of options that are good options, and now we're trying things that we don't know if they're going to work. And that has really changed in clinical research. We now know when a medication is first given in humans, we used to give it and say, is it safe? That was a phase 1 clinical trial. Is it safe? Phase 2 was, is there any activity? And usually it was given to a mixed population of cancers, all cancers sometimes. And then it was finally a phase 3 clinical trial where we would get an approval for one kind of cancer. And those have really changed and also accelerated. So now when something is ready to be given in humans and we're looking to see if it's safe, we usually know what kind of cancer, even what subtype of cancer it would be good for. We also know that it would probably be better after one medication or another medication, and that's information that we didn't have even just a few years ago. But because science it's changed so much, because of technology, it's possible. So now we are seeing that people are being given medications that are more effective than they used to be. We know that they are safer, and oftentimes we're using medications in new ways or in new combinations. And so for many people, I think the old idea that I would be a guinea pig if you put me on a clinical trial, or that I'm trying something that's never been tried before and we have no idea if it's going to work, is really old information. And as we move into this kind of more advanced research, where we have an idea about who it should work for, how it works, when we should use it, and also, which combination we should use it in, hopefully we're giving people access sooner. So I think that the most recent and current clinical trials that we're seeing are really exciting for patients because oftentimes they are access to treatments that we know are effective, and we're using them in new ways or in new combinations. And I do think that it's for many women going to add months or years to their lives. And so I think that it's an important shift as the technology's gotten better, as science is moving from the lab into clinic faster, and that people are seeing clinical trials that are being used earlier and earlier, and hopefully instead of being used at the end, we're using them in the beginning to get more cures.